The following presentation shows that coronavirus infections can be detected by nonlinear system analysis. The case of a 32-year-old physician working in a Munich hospital and suffering from COVID-19 is presented. In a regular test, he tested positive for coronavirus SARS-CoV-2 on March 18, 2020, and was sent into quarantine. The following pictures show NLS analysis of different organ systems on March 21, 2020, that means 3 days after regular testing. We start with the view of the head. In the upper picture, you can see the current findings, which show a medium energetic regulation disturbance. This can be recognized by the numerous downward triangles, especially in the area of the paranasal sinuses, which corresponds to grade 4. For explanation, the yellow markings are grade 2, the upward pointing triangles correspond to grade 3, the brown markings in the area of the right eye correspond to grade 5. Black markings corresponding to grade 6 are not visible on the current illustration. Everything up to and including grade 3 can be described as energetically normal. Grades 4 to 6 are signs of an energetic regulation disturbance. If the coronavirus is now inverted by removing the information of the virus from the observation in a so-called Vigito test, the result is the picture shown below, which is 43% better than the initial result above. The lower picture shows how much better the energetic result would be if the corresponding information of the coronavirus was not available. This statement is therefore to be understood purely diagnostically and not as a therapy. The numerical value of 43% can be seen in the lower right picture. The energetic improvement achievable by inversion correlates with the severity of the infection. At this point, the patient is visibly ill and shows the symptoms typical of coronaviruses, such as dry cough, sore throat, loss of smell, and general indisposition. The figure also shows fatigue, which is manifested in the form of numerous downward pointing triangles in the frontal brain area. If the information of the coronavirus is taken out of the observation, the result improves by 1 unit and the patient has a regular energetic result again with grade 3. It should be noted that this is a diagnosis, not a therapy. In the following, further organ structures are presented, all of which show similar findings. It is shown that in NLS analysis, practically all organs carry the information of coronavirus. The image of the nasal mucosa shows a slight energetic disturbance, which improves by 38% when coronavirus is inverted. The image of the red bone marrow shows a good energetic finding from the beginning, which improves by 17% when coronavirus is inverted. Interesting is the imaging of the lung tissue, which shows an energetic disturbance with many downward triangles. If the coronavirus is inverted, the energetic result is improved by 36%. The result image shows almost a normal energetic situation again. This constellation correlates with the clinical condition of the patient, who actually suffers from breathing difficulties. The image of a lymph node, which is representative of other lymph nodes of the patient, improves by 35% when coronavirus is inverted. According to previous experience, lymph nodes are typically affected energetically at a very early stage and to a very pronounced extent in corona infections, and are therefore very useful for diagnosis. The spleen also provides valid information in the diagnosis of corona infections. While the initial finding in the upper picture shows a clear strain, the lower picture shows a regular energetic finding after inversion of coronavirus. The improvement is a clear 52%. The image of the tonsils shows only a discrete energetic disturbance, which improves by 13% after inversion of coronavirus. This corresponds to the patient's description of suffering from mild sore throat. The imaging of the so-called chromophilic adenocytes is also important. Chromophilic adenocytes represent a cell structure in the pituitary gland and correlate best with the condition of the patient. If you want to know the clinical condition of a patient with the help of NLS analysis, it is recommended to search for chromophilic adenocytes. The value of 47% displayed here indicates that the patient feels tired and exhausted. A control analysis on March 23, 2020, that means 2 days after the initial examination, shows that the energetic situation in the NLS analysis has improved significantly. The patient himself describes himself that he also feels clinically better in accordance with this finding. The cough has almost completely subsided and the tiredness was no longer as pronounced. In the control analysis, the spleen showed an improvement on 44% in the energetic findings. It should be noted that this is not an inversion measurement, as was always the case in previous analysis, but merely a comparative measurement 2 days after the initial analysis. In the control analysis, the tonsils show a normal result again. The red bone marrow improved by 17% compared to the previous measurement, the lymph node by 26%, and the chromophilic adenocytes by a clear 66%. The latter correlates with the improvement in symptoms described by the patient. In summary, it can be said, NLS analysis is suitable as a screening method in the search for coronavirus infections. This was found in numerous other analyses of patients who had previously been tested for coronavirus SARS-CoV-2 according to regular principles. If there is a positive regular test result, the NLS analysis also indicates a corresponding positive result and vice versa. The quantitative improvement of the energetic result in the NLS analysis correlates with the clinical condition. The higher the value, the worse the clinical condition of the patient. The lower the value, the better. The experience from numerous analyses also show that lymph nodes, spleen, and lung tissue in particular are best suited to diagnose coronavirus in NLS analysis. The impressive thing about analysis is that all patients tested so far have been diagnosed via the so-called remote analysis. That means without being personally present during analysis. Nonlinear systems are able to carry out analysis based solely on name, first name, last name, age, and home address of the patient. Take a look at the internet at www.healing-codes.com. There you will find further information on the topic of nonlinear system analysis, remote analysis, and the possibilities of energetic informational discharging. Thank you very much for your attention.